Hi, my name's Alison. I'm currently working in Nil Dental Clinic, which is a small town midway between Melbourne and Adelaide. Not a lot of people have heard of it, but we do a lot of great things. So I'm just going to talk to you about today. Dr. Martin Hall mentioned earlier oral health educators, and that is what I do at the clinic in Nil, and I was actually in the same class as Lulu, so that's great. So I'm going to talk about what I do with the clinic in terms of seeing patients, and then I'm also going to talk a little bit about what I'm doing in the community as well. So I just wanted to give a bit of background information on why I personally did the certificate for. Always been interested, of course, in getting into the community and helping people, so I thought this was a great opportunity to get out and just educate people more and do that one-on-one with them, as well as do group talks like this. So an oral health educator, being a new position in the dental field, a lot of people aren't aware of what we can do. So we are able to do things like oral hygiene instruction, saliva testing, plaque counts, diet analysis, and then education sessions to lots of variety of people like sporting clubs, nursing homes, people with disabilities, and then do oral pathology checks as well for those people, and then also help the nurses create an oral health care plan for those. So we want to be able to change the way people are thinking about their own oral health, and we want to make sure we're changing things from being that cure and I have a toothache, I need to get it fixed, to how can I prevent myself from getting that toothache in the first place. So that's where we come in helping educate people and re-educating them, so they're not like, oh, we've got to go to the dentist to get that fixed, more than I need to go to the dentist and get checked so I don't have any problems. So people can come in and talk to us one-on-one and see how they can help change their own oral health. It's really beneficial seeing your own patients because they do get that one-on-one care, and it is tailored personally for them, so they understand that what may work for one person is not necessarily going to work for them as well. It's just a very rewarding experience to see them change and understand that they have this certain problem that they think no one's been able to help them with, and then I come along and they think, oh, someone's listening to me, I understand, and we can help them with that. And when I first graduated, I had a patient who was a 16-year-old girl, and she was having lots of caries, and she wasn't understanding why. She brushed her teeth, she was very good, she had a very good diet. So I started off my saliva testing and found that her saliva was very acidic. So I did a few little more tests and spoke to the mother and got more of a background information, and it turned out that I thought that she may have had diabetes. So I spoke to the mother more about that, and they went and got her checked, and it turned out that she did. So then when they came back and told me those results, we then tailored her oral health care plan to suit her new diet and new lifestyle. So I also dress up as the Tooth Fairy, which is very popular around town. So being a small community, I often get people coming up to me and they don't actually know my name, they just know me as the Tooth Fairy. So that's very good. The kids love it, they really get into it. They are asking me all sorts of questions about being the Tooth Fairy rather than dental questions, but that's okay. More questions along the lines of, why are you in your nighttime gear rather than your daytime gear, which I thought was an interesting question. So they got to come into the clinic. It was a really good experience for them. It was part of what we were doing for the hospital. They got to go to the emergency room and allied health and see all those things, and then dental was also part of that. So we showed them the dental clinic and showed them the things that we use there and what they'd be doing when they were there. And then they got a little activity book that I created for them, just full of colouring pages and things. And they got a toothpaste, stickers and a little brushing chart. And that was a really positive experience. We had lots of parents coming up to us afterwards saying that they really enjoyed it and they wanted to see it happening every year. Another one of the projects I've done as an educator is going out into the disability day services. So we did, over the area, we had 3 services that are in the Western area. And we went and presented to all 3 of those about brushing and oral care. And then we got some surveys back from them to see where the education was at. So I sent these surveys out beforehand to see where the education level was and to see where I needed to work on, and then got them back afterwards so I could see when we go again next year where we need to improve on and what they already know and what they don't know. So the benefit of having an oral health educator like myself in the clinic is it is giving the clinicians more time to spend with their parents during treatment, with their patients during treatment, so that I can sit down with them and have that lengthy conversation. So patients don't feel like they're being dismissed, like, oh, just go brush your teeth. They get to come and talk to me and be like, this is how you personally need to brush your teeth, this is how you need to care for your teeth and your own oral health. And you can see that they appreciate that, and they can see the change in the clinic, and they mention that, you know, they've never had this before and they've just been told to brush their teeth a certain way, and that's just how it's always been. So it's really beneficial for them. And by increasing their oral health, their treatment success is a lot better then. So we get patients not coming back as often to be retreated for fillings and things, and they're coming more often for their checkups and getting a better report there. In terms of funding, I generate $127.25 for a 45-minute appointment for our clinic. That's based on DYR 385.64. And I also, because we are a hospital organisation, because I do health promotion, we get extra funding for that as well. So we're able to buy resources like models for showing people how to brush and lots of posters and lots of visual things, because people are visual learners when it comes to their education. So it's much easier for me to explain to someone how to physically brush their teeth how they should be, rather than me just say, oh, just brush it like this. It's much more successful for them. So our future plans, we actually currently have our mobile dental clinic, which we're very proud of, and we go around to all the schools in our area, because some people are not, do not have access to dental clinics very close to them. And most parents are working, so they can't take their kids out of school. So we take the clinic to the school and see the kids and do the treatment in the van. We're very proud of that one, that's very new. And I go there as well and do education sessions for the schools as well. Do nursing home visits as well. We're looking at going to the sporting clubs around town and talking about mouth guards and, you know, what to do if you lose a tooth. We actually had someone in our local footy team on the weekend had a tooth fall out. He had knocked to the head, tooth came out, trainers didn't know what to do. So I was like, I need to go speak to those people and make sure that they know what's going on, because unfortunately I wasn't at the game, and I think his tooth was saved, but for future reference I may need a little bit more education on that, so I'll be able to go and provide that for them. And of course more tooth fairy visits as they've been requested, and I think are very popular, and personally I don't mind dressing up as the tooth fairy, so. And thank you, and I'll be around for questions if anyone has any later.